Welcome to the Masters of Medicine series by White Coat Hackers Media. In this program, we revisit the scientific legacies of the pioneers and geniuses who shaped the course of medicine. By exploring their groundbreaking contributions, we honor their names and celebrate the minds that continue to inspire generations of healthcare professionals.
Welcome to this special edition of The Deep Dive. It's part of our Masters of Medicine series from White Coat Hackers, where we look at the real giants who changed how medicine is practiced.
That's right.
Today we're focusing on Professor Gazi Yaşargil. People often call him the father of microneurosurgery. Quite a title.
It is, and absolutely deserved. Before Yaşargil, many brain and spinal surgeries, they were incredibly risky. His work wasn't just an improvement, it truly revolutionized the field. Things considered impossible became almost routine, relatively speaking.
Okay, so let's paint a picture then. What were neurosurgeons actually up against before his big breakthroughs?
Well, think about trying to remove a tumor deep inside the brain. You're limited by what you can see with the naked eye. The instruments weren't designed for super fine work.
Right.
So distinguishing tumor from healthy, vital brain tissue, extremely difficult. The risk of causing serious damage, paralysis, loss of function, it was immense. Surgery was often a last resort, and the scope was frankly very limited.
Got it. So our mission today is really to unpack Yaşargil's key contributions and understand why they're still so foundational for, the whole biomedical world.
Exactly. And to do that, it helps to look back a bit. He was born in Turkey, 1925, studied medicine in Germany, then Switzerland, Jena, and Basel.
Okay.
But his real path started in Zurich under Professor Hugo Kreinbuhl. That's where neurosurgery really grabbed him.
And presumably, seeing those limitations firsthand in Zurich must have sparked something.
Precisely. By the late 50s, he wasn't just seeing the problems, he was thinking about solutions. He had this vision that surgery could be much, much more precise.
And a key part of that vision involved seeing better, right?
Yeah.
The microscope.
Yes, absolutely pivotal. Bringing the operating microscope into neurosurgery in the 60s, that was Yaşargil's move. It was transformative. Suddenly, surgeons could see tiny blood vessels, nerves, subtle tissue differences.
It's like going from a blurry photo to high definition.
Exactly. That level of magnification changed everything. It opened up possibilities for navigating the brain with unprecedented safety and accuracy.
But seeing is one thing. You need the right tools to actually do anything at that scale.
You're absolutely right. That was his next crucial insight. He knew the existing instruments were too crude, so he started collaborating directly with engineers.
Oh, okay. To design new tools.
Yes. Specialized microsurgical instruments. Things like ultrafine forceps, imagine tweezers delicate enough to handle a single tiny nerve fiber microscissors, special retractors to gently hold brain tissue aside, and importantly, bipolar coagulators.
Bipolar coagulators, what exactly do those do? Why were they so critical?
Well, controlling bleeding in the brain is obviously vital. Traditional methods could sometimes damage surrounding tissue with heat. Bipolar coagulation uses a very localized current between two tips.
Just between the points.
Exactly. It coagulates tiny blood vessels precisely where you need it with minimal heat spread. Essential for delicate work. And, many of these instruments he helped design, they're still standard today. Some literally have his name on them.
Incredible. And then there's the Yaşargil aneurysm clip. That always comes up.
Right. The aneurysm clip. Before him, treating a brain aneurysm that's a weak bulge in a blood vessel wall was incredibly dangerous. Clipping it off risked damaging the main artery.
So what made his clip different?
It was usually titanium, very precisely engineered. The design allowed surgeons to gently close off the neck of the aneurysm, excluding it from circulation without squeezing or damaging the parent artery it stemmed from.
Okay, so it isolates the weak spot safely.
Perfectly put. It was a genuine game changer for vascular neurosurgery. Made treating aneurysms much, much safer.
So his impact clearly went beyond just aneurysms. These techniques applied more broadly.
Oh, absolutely. His microneurosurgical approach became the foundation for treating all sorts of things. Complex brain tumors, those tangled blood vessels called AVMs, cavernomas, even tricky spinal cord lesions.
And he wasn't just developing these techniques, he was mastering them himself.
The sheer volume of his experience is staggering. He personally performed over 7,500 major neurosurgical operations. Think about that level of hands-on skill.
Wow. And he didn't keep that knowledge to himself, did he? He was a big proponent of teaching.
A massive influence as a teacher. He trained over 300 neurosurgeons personally, people who came from all over the world to learn from him in Zurich.
And they took his methods back home.
Yes. Many became leaders in their own right, heading up major neurosurgery departments globally, so his influence spread exponentially.
And was it just about the how-to of surgery, or was there more to his teaching?
Much more. He emphasized meticulous anatomical knowledge, of course, but also rigorous surgical discipline. Patience was key. Respect for the tissue, deep care for the patient as a whole person.
So a whole philosophy, really.
Exactly. And specific techniques he pioneered, like how to carefully dissect the Sylvian fissure. That's a major groove on the brain's surface, providing pathways to deeper structures. Or how to navigate the incredibly delicate brainstem. These are now just fundamental parts of neurosurgical training, textbook methods.
And he kept going, even after leaving Zurich.
He did. In the 1990s, he moved to the University of Arkansas for medical sciences, continued operating, continued teaching well into his 70s. His dedication was just immense.
Which led to that incredible recognition.
Yes, being named Neurosurgeon of the Century by the journal Neurosurgery in 1999. A fitting tribute.
So if we try to boil it down, beyond the microscope, the clips, the techniques, what was at the core of Yaşargil's genius? What was his driving mindset?
I think it was this unique combination. He had the hands and precision of like a master watchmaker, but also the deep scientific curiosity to constantly ask why and how can this be better?
And empathy, too, you mentioned.
Crucially, yes. He had this profound respect for the brain, not just as an organ, but as the seat of, who we are, our thoughts, memories, identity. That drove his focus on minimizing damage, on preserving function.
Which connects directly to this idea of functional design in neurosurgery, doesn't it? It wasn't just about removing the problem, but doing it while keeping the patient as whole as possible.
Absolutely. You've hit on a key point. He wasn't just fixing anatomical issues. He was pioneering techniques and designing tools specifically to preserve neurological function. That focus on functional outcomes, minimizing invasiveness while maximizing precision, that's his foundational contribution to modern neurosurgical thinking.
So his legacy isn't just in the history books, it's in operating rooms every single day.
Every single day. Every time a surgeon uses microsurgical techniques based on his principles, every time an engineer designs a tool inspired by his approach, his influence is there. He built the platform.
He really did provide the foundation for so much of what's possible now, and inspiration for surgeons, engineers, students.
Definitely. He showed what dedication to precision and a deep respect for the complexity of the brain could achieve.
So, summing up this deep dive, Professor Gazi Yaşargil, pioneer of microneurosurgery, inventor of essential tools like the aneurysm clip, a hugely influential teacher. He didn't just contribute to neurosurgery, he fundamentally reshaped it.
A true master of medicine. His vision transformed the treatment of devastating neurological conditions and continues to inspire progress.
It really makes you stop and think, doesn't it? How one person's relentless pursuit of precision and innovation can change an entire field, impacting countless lives. And it leaves you wondering, what challenges in medicine today seem just as impossible as brain surgery once did? And who are the visionaries working right now, building on foundations like Yaşargil's to overcome them? Something to ponder. Thanks for joining us on The Deep Dive.